Well, I'm extremely busy, and so it's difficult to say that I have a lot of interests outside of medicine. If I go back to younger years, I certainly pursued music very avidly, and I would have liked to perhaps pursue that, as I suppose many people would, the equivalent of a rock star, but in an Indian setting. I actually learnt the tabla and the harmonium, and I would have liked to have had a career in that line. But I learned very early on that you need a magic ingredient. You need to have some talent, and you need to also have the right skills, and I didn't, and therefore I'm very grateful that I had medicine to fall back on, and I've enjoyed myself. I do also enjoy spending a lot of time with my children and family, and that's a great source of enjoyment for me as well. My name is Gin Malhi. I'm a professor of psychiatry at University of Sydney, and I head the Cade Clinic, which is named after John Cade, and it assesses complex patients with mood disorders. And at the same time, I also teach at the university and run a research program with a focus on functional imaging. My interest in psychiatry, it goes right back to medical student days. I actually wasn't even clear I wanted to be a doctor, but once I got into medicine, I really did find my passion. But within the training years, it was Professor David Goldberg, who was the professor and head of department at University of Manchester, who inspired me to become a psychiatrist. I approached him after I finished my medical training, and he told me to go and get some more broader general medical and surgical experience before coming back to psychiatry, and that's exactly what I did. That's an interesting question regarding writing the first paper. I recall it very vividly, more so than any other paper I've written. It was 1994 that we started writing it. It was a case report on a patient who had frontal lobe changes as a consequence of herpes simplex. I was doing old age psychiatry, and I was working with Tom Denning and Andrew Tarbuck, and in fact Andrew was the first author of the paper. But working alongside those people who are quite experienced and seeing how a paper gets constructed and why we were writing the paper really inspired me to get into academic psychiatry in a proper way. I think the question about what inspires people as regards research or interests them is quite interesting in and of itself, because anyone who does research day to day knows that a lot of the work is in securing grants, and even the research time that you have is taken up doing a lot of mundane things. And research in itself, once it's set up, normally takes care of itself. And more I find I'm actually distant from the contact time that I really enjoy. The key areas that I think that still inspire me are the questions, the models, the paradigms, thinking a little bit about the question in terms of how we're going to approach it, how we're going to try to conquer a particular challenge that we might be facing clinically. And then at the same time, looking at the data. That's really like Christmas, when you actually have the data and you want to first of all see, have you shown your hypothesis to be incorrect or true? And at the same time, what other things that you might find? So it's like Aladdin's cave, and you're hunting around for other bits and pieces. Unfortunately, often you find nothing, and that can also be extremely disappointing. Trying to pick a favorite paper is quite difficult of all the papers that I've written. I think there are many that I really have enjoyed, and many that I have put a lot of soul and heart into in terms of writing. So there are different types of papers. I think some of my editorials and commentaries I've really enjoyed because I think they actually are representative of my views and allow me to express myself more so than just in scientific terms. However, scientifically, there have been quite a few important papers, a few that I think are quite significant in terms of what they identify are recent papers. A paper that my group published a few years ago in biological psychiatry, which identified early changes in the brains of young girls, even prior to them developing depression. I think that's going to be an important finding upon which we're now building a lot of our research. At the same time, another paper that was published in molecular psychiatry in the same year looked at distinguishing borderline personality disorder and bipolar disorder, both of which I think clinically are extremely challenging, and it's an important question to be able to dissect them at a neural basis. So again, trying to find the end of the ball of wool, as it were, where this research should start. All of these are very tentative and early findings. They need replication, but they're still quite exciting findings. They're almost like a glimpse into the future as to what we might find. In terms of joining the illustrious board of EBMH, the main reason was that the editor, Andrea Cipriani, who's a good friend, asked me, and it's great to be able to have the opportunity to work with people of such intellect. The board is very strong, and Andrea has a great vision for the journal, and that inspired me to be part of it. I've also been editing other journals, and so I thought I genuinely could bring some expertise and experience to the task. But I also see it's important because I think it has a very strong educational initiative behind it, and summarizes a much broader area of psychiatry than some of the specialist journals, which really interests me. In terms of evidence-based medicine facing a serious crisis, I think it's really a matter of perspective. I think we do need evidence. There is no way of progressing psychiatry without having an evidence base. The question is, what is that going to be? And I think the discussion has to be about what we define as evidence-based medicine, and furthermore, what standards we set. And that's going to be determined largely by application. So, for example, in clinical practice, psychiatrists the world over treat patients one-to-one. Yet all our evidence is on groups or larger populations. So how do we translate information from population studies and group studies to make them relevant to individuals? And patients will always find that a particular drug works for them, and even though the evidence may not actually stack up in its favor. So clinicians are pressed to trial drugs and use drugs and draw on their own experience. And that's another form of evidence, an empirical evidence. How we collect that information and distill it down is also a challenge. But we do need different types of evidence base. So I actually think it's a good thing that we're questioning the evidence base, that we're challenging it. We certainly don't want to dispense it. We need it. It's a fundamental part of what we do. But I think we do need to examine it closely and identify those bits that are useful, and perhaps also have some structure about understanding evidence and translating it both for other researchers, so it's easy to understand, but also for clinicians and patients. In terms of the major challenges that psychiatry faces, I think there are a huge number of those, and there are really significant obstacles for psychiatry over the next 2 decades. Psychiatry, if you look back, has always tried to be part of medicine. It's always been the poorer cousin of general medicine and surgery, and it's been striving for identity as a specialty. At the same time, it has to have very strong links with other disciplines such as psychology, nursing, and public advocacy and public health. And because of that, its boundaries are very porous and ill-defined. And I think that's a challenge in itself. One of the core problems we have is that within psychiatry, we haven't been able to pin down our diagnoses. So despite a lot of investment in classification, our taxonomy still remains extremely poor and variable. And the fact that, for instance, in DSM-5, you can actually remove diagnoses which have been utilized in clinical practice with a pen stroke, and at the same time introduced de novo, totally new diagnoses, is quite surprising. So I think those are the kind of challenges that we have to overcome. We really need a scientific basis to what we do, and at the same time make people aware of the importance of psychiatric illness. And I think that's something we haven't done well either. As a consequence, psychiatry still faces a lot of stigma.
Would you recommend a junior doctor to become a psychiatrist?
I think it's really interesting to look at the changes that have taken place in medicine and psychiatry, and the question as to whether I would at this stage advise other people to pursue psychiatry as a career is a complex one. I think firstly, medicine as a whole has lost its luster to some extent, largely because it's become very administrative, particularly in North America, less so perhaps in Europe and in Australasia, but still I think we're going to be tending that way. So some of the attraction of being a doctor and practicing medicine has been lost. However, within the specialties, psychiatry has a huge amount to offer. It's interesting when you ask medical students and others what they think about psychiatry. They all say they find it intellectually challenging and it's a fascinating topic. But that somehow is lost in the training, and then they all gravitate to other specialties. I think if we can hang on to that and actually make it evident to medical students that psychiatry truly is fascinating, it's a sophisticated discipline, and that they really should embark upon an academic career perhaps within psychiatry, we would get much more of an uptake. And I think that's really important. I would certainly strongly recommend anyone doing medicine at the moment to consider psychiatry as a profession. Extremely fulfilling, and you do make a change and a difference to people's lives. In terms of books and literature, there is a lot of things that you would have to read in order to understand psychiatry fully. But if there are key things, I would actually say that it's important to read patient narratives and stories that that others have written, perhaps with their own experience of mental illness. Kay Jamieson's experiences of her mental illness, for example, is a great place to start. In addition to that, general history and general literature which pertains to examples of psychiatric practice and also psychiatric experiences is also quite important. And there have been many books in that ilk in recent years. There are also movies that you can watch which I think have put psychiatry at centre stage and also illustrated some of the challenges that it faces. So I don't think there's really a narrow reading that one can prescribe. In terms of general reading day to day, I think it is important, however, to subscribe to one or two journals and be up to date and read that regularly. And one of them obviously would be EBMH. As we look back and, we see psychiatry developing and evolving, one of the interesting questions is what's likely to happen in the future and where is psychiatry going to be in 10, 20 years or even half a century from now? I think that, looking that far ahead is perhaps a little bit difficult, and we can't anticipate the changes that may transform not only psychiatry but medicine as a whole and indeed society as a whole. And if you look at the advent of the internet, you can just see what a different world we now live in. One of the interesting things for me is how psychiatry can perhaps utilize the internet and electronic media in terms of getting the message out to patients and also interacting with patients. Certainly where I work in Australia, one of the challenges is seeing people at long distance. So now Skype interviews, for instance, and assessments are quite common. To be able to take a history and talk to someone in several hundred miles away and not have the inconvenience of them having to travel is a huge advantage. But I think there's another step beyond this. Some people are working on developing avatars whereby one avatar can talk to the other in a virtual world. Now, this does provide some security to patients, and it's also a novel way of interacting and perhaps role-playing some of the problems that they're facing. But it's a new technology, a new environment that will need to be explored and investigated, and obviously we need safeguards around it as well. But I think psychiatry certainly can be at the forefront of these developments, and I see all of this being extremely useful to us. In addition to in my own interest in terms of mood, for instance, actually monitoring mood day to day and monitoring the brain. Technological advances are helping in terms of tapping into measuring changes much more frequently than we ever can with paper and pen tests or interviews. So again, these are the kind of things I think we're going to see more and more, and people are going to provide that type of information to us, and we'll get a much better insight into psychiatric disorders as a whole. I feel like I'm going for an election or something. Yeah, vote for me, vote for me. Stop asking these questions, Andrea. I'm not a candidate for something.